Hey, so here we are. It is my second week post-op update. For those of you listening to this for the first time, this is I'm just kind of documenting my recovery of ACDF surgery. This is the third video that I'm doing. So if you haven't seen the first one explains, what I had going on, why I had elected to get a four-level ACDF surgery, what all that is. It's about a 13-minute video. It's the first video in my ACDF playlist. And then I also have a second video that's about 10 minutes that goes over my first week post-op, pretty much 7 days, what I experienced, after surgery and all the challenges and recovering, just the first 7 days. And so that's my second video. And then this is my third video, which is pretty much 2 weeks after my surgery. It seems like it's been a month because there's been a lot that's gone on in the last couple weeks, and I'll jump right into that. But if you haven't seen those other videos, I suggest checking that out first, so you kind of have my backstory. You can kind of see what has led up to where we're at today. So if you recall in the last video, I'm in really good spirits. I'm one whole week out of my surgery. I had some swelling that went on. That video kind of goes into detail what all I experienced. And so here we are. Today is March 22nd. Pretty much, yesterday would have been a full 2 weeks after my surgery, my first surgery. And so during my second surgery, my second week, there was an emergency surgery that was scheduled. That's right. So there was an emergency surgery that was scheduled, and I'm going to go into that right now. So again, if you recall where we last left off, in the last video, I was in good spirits, but I kind of left off here with this lump that had been growing right around the incision area. Otherwise, I was doing well. My pain had subsided. I'd already gotten off the pain meds, and I was just kind of really getting back to starting to feel like my normal self. But at the very end of my video there, I kind of go into a little bit about I've got some discoloration happening in my chest, and I've got this lump after the general swelling had gone down. I've got this lump that's kind of formed right underneath my incision, right where they worked on my neck area. I continued to send pictures in to my doctor, and ultimately, the very next day, after the last video I did, here's what it looked like. The discoloration had gotten really dark, and it became a lot harder, and so it was very concerning. And so the doctor called me in right away. I went in. He said, "Can you meet me at the office at 8 a.m.?" I met him at the office first thing in the morning. Ultimately, he reviewed everything. His assistant reviewed everything, and they sent me down to get some more X-rays. And ultimately said I've got a hematoma, and this is something that is not all that common, although it does happen. But basically, our bodies will create this hematoma usually around a wound or a cut or an incision. In this case, this is a post-operative hematoma that's happening in the area. One of the assistants that I was talking to there when we went in there asked him, or I didn't even ask him. He said he'd been at this, at Sierra Pacific Orthopedics for 7 years, and in the 7 years that he's been there, they do about 400 of these surgeries a year. He said he's seen this maybe 3, maybe 4 times in that 7 years that he's been there. But all kinds of things I was thinking. I was thinking they might need to drain it. They might need to go in there and I don't know, clean it out. But I didn't think I was going to have to go to surgery again. And ultimately, that was the prognosis. And so, a a hematoma is basically, kind of like I was saying, one of the rare but not totally uncommon things that could happen after you have this type of procedure. As you can see here, you may develop a lump under your incision following an ACDF procedure. If it gets too big, they're saying that you need to, raise your hand, raise a red flag, say something, and that's ultimately what I did. And so, that's kind of what I found, online as far as what I have. So at the doctor's office, when I went in, they went ahead and they took surgery. They took X-rays again, and it was very evident that I had quite a bit of swelling going on. Obviously from what you can see externally, but once they took the picture on the inside, here's on the right, so we know what we're looking at. This is my spine before surgery. Totally untouched. This is my normal view prior to having surgery, and then this is day 9. I went in. They took the scans there, and so you can see my hardware that was installed. Those are the cages, the spacers to create that space to alleviate my spinal cord through the ACDF 4 levels that they did there. So 4 spacers there with screws. Um, but of significance, what we're looking at here is if you look at the lining of my neck, normal. And now post surgery, we've got this swelling that's taking place. It's a big, huge, it's very noticeable, very significant compared to what's going on here. And the concern with this is what they were saying, and I've also did some research on this as well, is if this doesn't get fixed right away, it could obstruct breathing, and swallowing more so than I was already experiencing. And so they scheduled a surgery that night. Literally, I went in on a Wednesday. They did all this stuff 8 o'clock. I think I was there till 10, and they said, "Can you come in at 3 o'clock and check in at the surgical hospital? We're gonna go put you under and get that all cleaned out again." And I was like, "Wow, okay." So it's kind of a lot happening at once. Started asking, that prompted more questions. So what exactly is going to take place? Ultimately, he said, "Well, we're going to open you up and clear out what we can, but more so inspect the area to make sure that there's nothing crazy going on around the spine." It's one thing to have a hematoma, externally or from the spinal area, but he says that once he gets in there, he's got to be prepared to maybe remove 1 or 2 of these if he recognizes anything that's going on within the spine as far as a hematoma, because that can create complications down the road. So ultimately, open me up, clear this stuff out, and potentially have to go in there and remove and replace anything, within the spine, which really had me very concerned, because I had just gone through this whole surgery a week ago, and the amount of trauma that your muscles and everything goes through when they cut you open and spread open your voice box and your throat to get in there, and you go through quite a bit of trauma. In that whole first week, right? That's what I recovered from and did all the pain meds, and it took me a good solid week to feel normal again. And so it was concerning, that I was going to have to go back in there again and potentially re-traumatize that area, right? Where they go in, and if he had to go in with the drill again and take out spacers, like, all in less than 7 days from just doing this the very first time. So that was a big concern to me, in doing this. And so, but it was something that had to be done. And so we went in, it all happened very quickly. And so there I am, I think I went home, I took a nap, tried to anyway, and just prepared for surgery again. Thankfully, I didn't eat that day. I just had some coffee in the morning. And so I check in at 3 o'clock. I go into the surgical hospital. This is again the whole thing that I thought was totally done with. And 7, 8 days later, I am back in surgical. I'm back in the OR, in the operating room, and it was a little surreal. Kind of happened all at once. I made the decision. We went forward. It was kind of different because he didn't justify it as an emergency surgery at 5 p.m. where a lot of them aren't being done, and so I was pretty much the only patient in there at 5 o'clock, and it was the same old thing. They did the whole same old drill where they ask you these questions and they hook you up and take you inside. And I went into the operating room the same way I did the first time, and then you go under, and and then I was back out. So that all happened. They kept me for one night, and I was in I felt very well. The first night I didn't have nearly the pain. I was no longer taking any pain meds. I didn't take any pain medication other than Tylenol. So it felt good to not have to do that. And I knew, right after surgery, based on the way I was feeling, that it wasn't as intrusive and he didn't have to, go in there. He did confirm he didn't have to replace anything. He didn't have to go too far deep in there and move stuff around as much. So not as much trauma. And I could feel it. So I immediately that night felt on track, right back on track to the healing process. I hadn't eaten all day. I think it was 7:30, 8 o'clock at night. They brought me dinner. I ended up asking them for another meal. Like at midnight, I had a sandwich. And then I had an early breakfast. I mean, I was starving. And that was a huge sign of how different the second surgery was, because I could barely eat after the first surgery. And I was so nauseated and in so much pain, or under the influence of pain meds, to barely eat. So I felt very good. And here's a picture of me going home the next day. As you can see, it's that hematoma is completely gone. I'm feeling good. I kind of rest up a little bit, but ultimately, just kind of a bit of a scare. Didn't, unexpected, and just kind of happened all of a sudden and very quickly. It just kind of unraveled, and lo and behold, like before I knew it, there I was back in the recliner, back at home, and just kind of sitting back and reflecting on what just happened. A lot of my family and friends were like, "What? He's going back in?" And I was like, "Yeah, I know, I'm going back in." Um, so a little bit of a scare, but thank God everything worked out, and very minimal needed to be done. Again, today is the 22nd. As you can see, everything is cleared up. Here's a little before and after. I know that's gruesome. Sorry. But that's the difference that made there, that hematoma that had grown. I'm certainly happy that we were able to get in there, get it taken care of with very little, to no, little to no trauma that I experienced the first time. So here I am today, and as you can see, I mean that lump is gone, pretty much altogether, and I feel great. I'm eating. I'm no longer on pain meds. I haven't been on pain meds since the first week. I think I did a little bit of pain meds when I came back, just to kind of relax a little bit, and but that was probably day one after being home. I'm literally 2 weeks post-op, and I'm feeling great. And so that's my update. I want to thank a lot of my friends and family who was praying for me, worried about it. I want you guys all to know I'm great. I'm feeling great, and pretty much back in the saddle when it comes to doing work and stuff. And now with this surgery, of course, I'm still very limited on what I could do. I still got all that apparatus that's in my neck. The next phase, that I've got to work on is bone fusion, and bone fusion takes anywhere from 6 months to a year. When they remove those discs in between your vertebrae, they put those spacers in there. They're cages, and in the middle of those spacers is like bone cadaver, right? And so your bone is actually going to grab onto that and then fuse, from one vertebrae to the other. And on mine, I had all 4 levels there. So that's a 6 month to 1 year process, and I've got to be very careful about how I'm moving. What I should be wearing my neck brace right now. Um, but there's still a long road ahead when it comes to recovery. But I think the first week, first couple of weeks are crucial for anybody who's thinking about getting this type of thing done. If you're going to get this done and you have the same type of symptoms that I have, I strongly, would suggest you get a hold of your doctor. I wasn't sure if this was normal or not. If you look at my last video, I'm sitting there explaining everything that's going on, and as this hematoma was there that needed to be addressed. Um, so anyway, that is my 2 week update. Doing well, doing great. Still got lots of work, to do when it comes to recovery and being limited. But I'm feel good, and looking forward to moving forward. So anyway, that's all I got, and you guys take care.